My name is Lynn Gallenbeck. I am the nursing team leader for the orthopedic unit. The rooms that you'll be going to post-operatively are on this floor, on the 6th floor where you are right now. We have 22 all-private rooms down on the north end. We have 6 more down here that we also use. Judy Haynes, my nurse manager, and myself oversee both sides. Okay, so inside of your booklet, you will find a book on the procedure that you're having done, the hip replacement. There also is some information for Meals on Wheels in there. Some people need a little bit more assistance after surgery, so we put some information for Meals on Wheels in there also. There is a list of the Erie County rehab facilities where you might be going to post-operatively. At this point in time, your doctor probably told you if he wants you to go to rehab or not, but we always recommend that you take a look and through this list and choose a place. Sometimes things happen when you're here that your plan as it is right now doesn't work. Maybe it's a little bit more than you thought it was going to be, or maybe your setup at home isn't really conducive for you to go home right away. So usually, like I said, at this point your doctor has probably recommended if you're going to go to rehab or not. But we do ask you to take a look through there and find a place where you might want to go to. Our discharge planner will be here a little bit later and she'll go over that a little bit more with you. There's also a healthcare proxy. There's a big push now for a healthcare proxy across the nation, so we definitely are on board with that. If you have a healthcare proxy already, we want you to bring it with you when you come and we'll make a copy of it. If you don't have one, take this home, consider who you would want to be your proxy, and fill it out at home. Your signature has to be witnessed by 2 people, not yourself and not your proxy. If you fill it out and leave it unsigned, we sign it when you're here in front of 2 witnesses. We can take care of the rest for you. We'll make a copy of it, keep it in your chart, and we'll give you back your original one. Okay? So the purpose of this class today is just to give you a little bit of idea of what's going to happen when you're here at ECMC for your hip replacement. We will have respiratory therapy here, discharge planning, and physical therapy or occupational therapy. They work together in conjunction as all part of the team. And we just want to make sure that we get everything, all your questions answered today that you might have before surgery. So that being said, please don't hesitate to ask any questions if you have them, okay? All right. So the morning of your surgery, you're going to go to room 160. 160 is our surgical waiting room. And it's also where you meet for pre-op testing. So if you've had your pre-op testing done, you know where 160 is. If not, it's on the 1st floor. When you enter the hospital, you're on the ground floor. So this will be on the 1st floor, all the way down to the right of the building. It's kind of a far walk, so being that you're having your hip done, if you need a wheelchair, don't hesitate to ask at the front door, and somebody from our transport will take you down to 160. Okay? So when you come in the morning of your surgery, you're going to go to room 160. You just need to bring your picture ID and your insurance card with you that day. You're not going to bring any of your home medications with you. We're going to give you your meds here. You can bring a list of your home medications that we'll go over with you again and again. But we just want to make sure that you're not bringing any of your actual medications with you. We'll take care of everything here. Okay? Your family will be given an ID number that's going to allow them to follow your progress on a big screen TV in the waiting room. They'll take the patient in the back, get you in a gown, and then they usually let your family come back in with you. They call it minimal separation here. Your comfort level is normally with your family, we know that. So we just let your family come back in as soon as they get you the patient all set in a gown. You're going to meet your surgical nurse, your anesthesiologist, and then also your surgeon is going to come. He's going to confirm with you what he's doing, left hip, right hip, and actually take a Sharpie and label what he's doing. Okay? At that point, he's going to let you know how long it's going to be. He's got a time slotted for you so he knows. It's usually 2 to 3 hours, but the doctor will give you a better indication at that point. And that's when we ask your family to be back in the waiting room, waiting for that doctor to come back in. Okay? He'll talk to your family, let you know how everything went, and then once you're awake enough in the recovery room, they again let your family come back in with you. Okay? We're doing our best to give a room assignment also early, so your family's going to know what room you're coming to before you're out of surgery. This way they can bring your belongings upstairs and not have to worry about carrying anything around, okay? So once you're awake enough in recovery, your family comes back in and visits with you, and then you come up to the floor. We'll get a report from the nurse taking care of you downstairs, and then you'll show up upstairs, come up, transport will bring you up, and we get you all settled. Our rooms are private rooms. They're very large. They do have a couple chairs in them that are, very, very comfortable chairs. There's a recliner, and then there's also another chair in the room that goes down folds out into a single bed. We do allow your family to stay overnight if you'd like to. By all means, again, it's for your comfort.